Hi again, and welcome to one of our last units in psychology about mental disorders. And today we're going to be talking about different psychological disorders and specifically anxiety disorders. Our learning targets for today are to explain what psychological disorders are and how prevalent they are, meaning how many people have them, analyze the four major symptoms that can help identify psychological disorders. Those are very important to know. And we'll describe how psychologists classify psychological disorders. Now, when we get into anxiety and mood disorders, we're going to talk about the common characteristics of anxiety, and we're going to analyze how psychologists explain anxiety and mood disorders, but we're going to talk about the actual disorders in class together. So here we go. Psychological disorders, if you want the textbook definition, are behavior patterns or mental processes that cause serious personal suffering or interfere with a person's ability to cope with everyday life. So the great majority of people who have psychological disorders are never admitted to hospitals, and they never seek help of psychologists or psychiatrists. Estimates are as high as 1 in 4 American adults have experienced some type of psychological disorder, and for people aged 15 to 44, they are the leading cause of disability in the United States. So how do we identify someone with a psychological disorder or a psychological disorder? People with psychological disorders are not that much different from you or me. They just have certain behavior patterns and mental processes that suggest they have a psychological disorder. So we use 4 criteria to determine whether a person's behavior indicates the presence of a psychological disorder. And the first one is typicality. Typicality meaning, is it normal? And in identifying is it normal, we have to assume that what the vast majority of people do is normal. So even though it may be wrong, it may be right, we have to assume that that is normal. So a certain behavior, is it average? Is it typical of the majority of people? Do they do it? So a genius, a scientific genius, is not typical, but is he abnormal? Is he different? Is it a psychological disorder? Absolutely not. So we need to have some more criteria in order to determine this. Maladaptivity means that it has to impair the individual's ability to function in everyday life. Does it cause misery or distress? Does it cause happiness or fulfillment? Or is it dangerous? If I like to put plastic bags on my shoes when I walk around, that's not typical, but it's not maladaptive either. So is it a psychological disorder? Not really. Emotional discomfort is the third. It does not cause me emotional discomfort to put bags on my feet. Depression and anxiety cause extreme emotional discomfort, and you get feelings of helplessness, hopelessness, worthlessness, guilt, extreme sadness, and withdrawal from society. And then finally, we have to ask ourselves, is it socially acceptable behavior? Putting bags on my shoes, not really. So it may be socially acceptable to like a contractor who comes into your house to work on something to keep your carpet clean, but other than that, it's not socially acceptable. So I've only hit 2 of the 4, which means it's not a psychological disorder. And also, the cultural context of the behavior must be taken into account. A culture-bound syndrome is a person who suffers from a cluster of symptoms, but it's only recognizable in a certain culture. In Japan, those who have Taijin Kyufusho, and that is not how you pronounce that, they are likely to be embarrassed of themselves for even being in existence. And it's like extreme social anxiety because it's a collectivist culture. They don't want to bother anyone with their individualist needs or even presence. So how do we classify, or why do we classify? Because it helps us to determine how prevalent a given disorder is, what different factors might be or could be associated with a disorder, and it helps us with diagnosis and treatment. So the DSM is the Diagnostic and Statistical Manual of Mental Disorders. And this is what the American Psychological Association uses to classify its disorders. Modern categories are based on observable signs and symptoms. And the good news about 2013 is that they just released the DSM-5, the 5th edition. This has been going on since the late 50s. They have revised it over and over and over, and now we're on the 5th edition, released in May of 2013. And the DSM-5 lists 20 different chapters of disorders, but the ones that we are going to cover in class are anxiety, mood, dissociative, somatoform, schizophrenic, and personality disorders. And here are some other ones from the DSM-4 revised. Sexual and gender identity disorders, eating disorders, sleep disorders, impulse control disorders are some other ones that are there, but unfortunately we don't have the time to cover them in Intro to Psych. If you do want to cover them, try going to an abnormal psychology class in college or online. Anxiety, what is it when we get to talking about anxiety disorders? It is a generalized state of fear or dread that comes from something that is vague or imagined, as opposed to fear, which would be to a real danger or threat. So some characteristics of anxiety are nervousness, you can't relax, you have concern about losing control of everything, you tremble, you sweat, rapid heart rate, shortness of breath, increased blood pressure. So anxiety is helpful at times because it does keep you on your toes for like a test or an athletic event or a performance, but constant anxiety can interfere with effective living. Now here are the types of anxiety disorders. I'm just going to flip through these, and if you want to pause them, you can, but we are going to fill in our charts together. So how do we explain anxiety disorders? We have different views. Different perspectives have different views. The psychological views, psychoanalytic views are no longer accepted, but they have affected the classification of psychological disorders. Learning theorists believe that phobias are learned in childhood. If your mother is scared of spiders, then you will learn to be scared of spiders as well, and that phobia is passed on. Cognitive theorists believe that it's all in a person's head. They make themselves feel anxious by responding negatively to most situations. And we know from biology that heredity plays a role in passing on anxiety disorders. Studies of twins that have a parent or sibling with a disorder increases the chance an individual will have the disorder. And basically, some psychologists believe also evolutionarily that people who acquired strong fears of real dangers are more likely to live and reproduce, and we may just be generalizing those fears to other objects and things. Here is a overview of the 4 perspectives on anxiety disorders. Mood disorders, then. Same thing with the anxiety disorders. I'm just going to flip through them here. There's only 2, depression and bipolar disorder. How do we explain mood disorders? Well, we have the psychoanalytic view, which means that in childhood, the child either lost an object or a person that was close to them. They then internalize their anger and direct it towards themselves. A learning theorist would point out that learned helplessness makes people prone. Someone who believes and tries over and over again to do something with not any different results is going to be out of their control, and they will assume that all future events are out of their control as well. Seligman did a dog shocking experiment where he took the dog and put it in a cage with an electrified floor and just kept shocking it. There was no way the dog could prevent it. And then when he removed the barrier so the dog could get out, the dog would then just curl up in the corner. It wouldn't even try to get out of the cage when it was being shocked. It sounds cruel, but it did help us learn about learned helplessness. And cognitive theorists would point to attribution theory. And people assign different types of explanations to events that help us affect our self-esteem and our self-efficacy. So we usually assign different explanations to events, whether it's an internally controlled or externally controlled, is it stable or unstable, and is it global and specific. People with depression usually place more blame on internal, stable, and global causes. Psychologist Beck suggests that people who are depressed have a negative view of themselves, their experiences, and their future. So they have a negative self-schema. And the biological views, basically it does run in family. Mood disorders occur more often in close relatives of affected individuals than they do in the general population. And two neurotransmitters, serotonin and noradrenaline, partly explain the connection between genes and mood. But more than likely, it's a combination of these factors. And here's a cartoon showing that it is genetic and also learned, because the dog is depressed as well. So here's your learning targets review. We talked about what psychological disorders are and how prevalent they are. We analyzed the 4 major symptoms that can help identify psychological disorders. And we discussed how psychologists classify using the DSM-5. We talked about common characteristics of anxiety, how psychologists explain anxiety disorders, and how they explain mood disorders. So welcome to your introduction of mental disorders. Next time we're going to talk about dissociative and somatoform disorders. So I'll look forward to seeing you then. Goodbye.